So this is another episode of Umwe Sit Downs. My name is Brian Akambonde, and today I'm joined by none other than Professor Binagwaho from Rwanda, the Vice-Chancellor of the University of Global Health Equity. Professor Binagwaho, welcome.
Thank you for having me, Brian.
Thank you for joining us today. And you know, we're talking with Professor Binagwaho today because one interesting thing that stood out from her, of course, from a stellar background and story, is two articles she wrote for the conversation. One was talking about Rwanda's COVID-19 vaccination program, and another one from a while back that really told an interesting story about Rwanda's HPV vaccination program. And this notion called implementation science, which for many young people like me and others who are not really in public health would benefit a lot from learning, because it was very well kind of explained and featured in how it was the success the success factor behind the HPV program in Rwanda. So before I ask Professor Binagwaho the first question, I'll just mention one interesting fact, which is in 2011, Rwanda started the HPV vaccination program when countries, developed nations like the USA, were struggling to achieve, population coverage that many were hoping for. USA only achieved 35%, but Rwanda went on to achieve 93% population coverage. And Professor Binagwaho in an article mentioned that, following implementation science and using that as a guiding way of thinking was a key success factor into that happening. So Professor, my first question to you is just to please explain what is implementation science, and while you explain that, I'd really like to understand the key factors about this way of thinking, that may have contributed to that success story of HPV. And I'm sure you remember the wonderful story that you wrote so well.
So Brian, I'm going to give you the definition of NIH that states that scientific studies of the use of strategies to adopt an integrated evidence-based health intervention into clinical and community settings to improve individual outcomes and benefit population health is the definition of implementation research. So that means you study, you have the evidence-based intervention to solve a problem. First of all, you evidence the existence of the problem. You evidence what science in general have already found as evidence-based intervention to solve it. And now you study your context. My context is not the same as in Brussels or in Accra. The context of Rwanda there's some specificity of the country that are linked to the culture of data use, the culture coming from our ancestral education before the colonial time, how we have been colonized, etc. The context will help us to decide what strategy to use or what strategy to transform to implement efficiently the evidence-based intervention known to solve your problem. So this is implementation science. And it's so important because people know, we all know what are the evidence-based intervention, because we learn that at school, or we read that in scientific journal, or in less scientific journal. We know the evidence-based intervention. We know how some countries have implemented that with success. But if we want to copy those strategies without taking care about our context, we may fail. And many African countries and others, even in Europe, when you say that they try to increase the uptake of HPV vaccine, they didn't succeed so well, just because there are some contextual factors that are neglected.
Thank you so much for sharing that, Professor. I think that's one thing that is very interesting, especially when reading on so many topics outside of public health. You kind of realize that sometimes it seems like the context of where I am, you know, makes things that I'm reading to be not so practical for my certain environment, and it's very interesting to see that be an issue in this big sort of like concept of public health that is now becoming a topic of conversation for many people. But nonetheless, you know, one interesting thing that also stood out for me is that after reading about the HPV, story, I also came across, I think from the same article, the fact that 90% of Rwandan children, are fully vaccinated against, are fully vaccinated for 11 vaccines, according to that article in 2017, which I mean, as you said earlier on, comparing to other African countries is tricky. So I'm not sure how that looks like in terms of compared to other African countries, but certainly it seems like a very large achievement, indicating how well vaccination overall is conducted in Rwanda, right? And so I'm very curious to hear from your side, Professor, you know, how has Rwanda performed in terms of vaccinating people against COVID-19 and other viruses in general, because again, you know, that key statistic of 90% of Rwandan kids being vaccinated seems to be something that proves that, okay, Rwanda is very efficient. And I'm just curious to see how your opinion on how, you've been dealing with vaccinating people against the COVID-19 pandemic.
Vaccination against COVID-19, it's just a vaccine like many other vaccines, you know? So when the world starts to run after vaccine for this disease, we get several types of vaccine that were at almost the same time are available to the world. So when I talk about, it's always the same thing. You need to assess your problem, you need to assess the context, and you need to select the implementation strategy to solve the problem. So the COVID need a vaccine to stop the spread of the disease. We need to stop the spread of the disease really seriously, because we cannot afford, like European countries or like the US, to have ICU that were overwhelmed. You remember that period. So we need to stop the spread of the disease, and vaccine is the best, still is the best preventable tool that exists. Of course, we still have masks, washing hands, social distancing, but the more efficient, all of them, more than 75% efficiency, is the vaccine. And especially when your population reach herd immunity. So we had that access to vaccine. Knowing your context is, how can I deliver it to the last mile with equity, efficiency, and also fairness? We just decide, the country, the Minister of Health, decide to do a list of those who will come first, because that's what we do when we don't have enough. We have a rationale to start by this group, go after by this group, etc., etc. And the rationale for the government of Rwanda is, who are the most vulnerable vis-a-vis the disease we want to control? And it's clear across what happened around the world, it is the health workers, because they are in front line. There is also the essential workers, because they are in a front line also of the economic life and the societal life of the country. Like, you have teachers to resume school. You have taxi drivers to drive the people where they have to be. You have the people managing the commerce to be able to sell you the potatoes, the tomatoes, the salad, the meat you need to feed your family. Okay? You have the people in security organs, so they can stand there and help you to the road to be safe, etc. And after that, you have the people that are vulnerable, not because they are on front line or they're at risk, but just because of their conditions, health condition, underlying health condition. And for this, Rwanda asked each hospital of the country to list the people with underlying conditions that put them at risk vis-a-vis the COVID. And after that, we all know the age. People above a certain age. So that's how the official list went out, and everybody agreed because it was based on science, based on, and you cannot discuss that because it is what the scientific across the world have said. Those are the people at risk. We don't have enough vaccine for everybody. Let's start by the most at risk and continue up to the others.
Right.
And that's how we had people vaccinated in prison, people who are more than 60. In refugee camp, they are not Rwandan, but they are at risk and under the responsibility of all of us because they are on our soil. Teachers, health workers, and people with underlying conditions.
Right. And it's I think this list, thank you so much for mentioning it, because I think it really puts a strong picture in front, right, of what it means to really, you look at the context of a country from a you know, like a public health standpoint or vaccination standpoint, to really understand then, okay, in this country perhaps, or specifically in Rwanda, you're saying that attending to people who sell at markets is a very crucial choice, where it may not be the same in another community, because those people, it's crucial for them to be protected and vaccinated. So it was very interesting to kind of hear that specific point.
Every country decide its journey. If you tell me, if you want the economic to restart, you need to have to protect the economic agent. So, conclusion.
Right. You know, very, very well taken there. And so, you know, before perhaps we move on to learning a bit more about this idea of implementation science, I just wanted to ask a follow-up question on if I may, on essentially procuring vaccination. You know, now we did a very comprehensive video that tried to kind of look at the general path that stands in front of most African nations, which was, you know, COVAX, and also the procuring vaccines from the African Union task force that is set up to assist you know, African nations in that regard. And I'm very curious, like, to what extent do you think it's necessary for Africa and many developing nations around the world to sort of be given the opportunity to manufacture, you know, vaccines more so in their own regions, for the sake of, you know, having better access to procure those vaccines so that they can meet their herd immunity targets? And I'm asking that because most experts seem to be saying that in the context of Africa and developing nations. And if you can comment on that, Professor, you know, I would certainly appreciate your thought.
I will comment and not answer what you ask me. I will give another answer. Meaning, do you believe, let's be totally irrational and imagine that in Mars, the planet there, they can manufacture in 2 days all the vaccine needed on us and bring it here in 5 days. Do you believe we will need to manufacture vaccine in Africa? Why do we need to manufacture them? It's because there is not enough. And because there is not enough vaccine, the best way is to multiply the number of places you manufacture vaccine, and not to be the last serve forever. Better have some place in Africa. If we do nothing, Africa will be correctly vaccinated in 2023. You find that correct? No. You know why also? Because the mutation of vaccine is faster than that. So in 2023, they will create new vaccine to respond to the virus of that day, when we are still not vaccinated for COVID-19 first formula. So there is no way to continue to be the last serve when we can produce. And it's the first time, it's not the first time there is not enough vaccine on us. You talk about HPV vaccine. Do you know that there was a stock out of HPV vaccine a couple of months ago? When I say a couple of, it was before COVID, so it's more than a year ago. So we need to have the capacity. We are a couple of billions, isn't it? We should not wait for the rest of the world to be served by themselves before being served. So let's start to serving ourselves and develop this capacity we have to manufacture with quality, efficient product according standards. So we manufacture for this reason.
Right, and very well said, Professor. There, you know, and I'll skip the question about you know, sort of comparing to other nations, and just get right to my last question, which is, you know, what makes it challenging to implement implementation science, or really apply that in full, you know, that way of thinking, because it seems like the idea is very intuitive, right, and simple, but it does seem that it's actually more challenging to put into practice, as I'm sure you know. So yeah, what makes it challenging for people to get that right in terms of, especially in the context of vaccination programs?
So let me answer you by the fact that before this wonderful story of an apple failing of Newton, gravity was intuitive. Is it because of that it was not existing? We need to develop our curiosity. And this is how I develop, we develop this science. How come that with the same policies, the same strategies, the same amount of money, the same evidence-based intervention, the same historical natural history of diseases, the same susceptibility to be infected, etc., some country make it, other country doesn't make it? This is science, guy, when you study this and you can replicate it. How come that the gravity at the North Pole is not the same as in our country near the equator? It's because of mass, it's because of acceleration, and etc. You can see that because of mass and acceleration, because mass multiplied by acceleration, etc. Make the force, and the way it's, the force by something failing is not the same to the two places. Gravity is not the same. You can prove it. Now, if you study some strategies to implement evidence-based intervention across context, you can see that there are some strategy that doesn't work. Let me give you an example that is far from COVID. And it's not a true one, but if in some countries, blue is not a color families like, do you believe they will take your bed nets blue? You want to fight malaria, take a color the people like, or go for changing that perception and make them adopt, make it feasible. So in implementation science, you have feasibility studies, you have all those steps to implement correctly that has to be ticked and fulfilled, like in any other science. If I want to take a truck 2 tons and want to lift it at the 12th floor of a building, I need to take in account the gravity, the 2 tons, and the material I will take to lift. If it's too weak, it will clack. If it's too strong, I invest money unnecessary. And you take account the context.
And so, Professor, do you feel like the difference between, as you said, one country, same resources, same, you know, kind of desire to look at the context, do you feel like the difference between getting it right and getting it wrong, you know, is sort of then maybe perhaps a failure to really immerse yourself in the context, or understand the context, or appreciate the context, or or is that fundamentally where you feel like, you know, when it comes to using implementation science to really have a successful vaccination or health response program is just really, you know, kind of immersing yourself in the context?
The context is wide. The demand of the population need to be there. You may have the best vaccine, enough in storage, enough people to give it, and people doesn't want it. Why? You may have people wanting it. You have the vaccine, not the good storage. You inject them, not a vaccine that is efficient because you have destroyed. Okay, you may have the demand. You may have people who want to sell and no willingness to buy the vaccine. So you need all the context to be aligned for the health outcome to be reached.
Right. Wow. Thank you so much for that explanation and for your input on all the questions I came with today. I really appreciate your time, Professor. And you know, with the good work you're doing at your university, I hope that that, you know, we are only going to get better in terms of how we respond to public health crises in Rwanda, and hopefully other people are learning from your good work and university.
Absolutely. And the University of Global Health Security is an university based on implementation science, because everybody have to learn to pass through the master of health service delivery. And to do that, you need to implement, you need to be able to contribute, transforming and building a health sector where the demand of the people exists. That means there is trust and the right information. And when the health service can provide the service correctly, respecting the cold chain, the doses, the avoiding stock out, and when the people who give those services are well trained to give it. And that's what we teach our students.
Right. And any last words from you, Professor? Our audience is typically, we're trying to engage the young African youth who are curious to learn through YouTube and Instagram as well. So any last words that you'd like to share? My
last word is Africa has done well during COVID, not because by chance, because of better preparation. We have seen that in worse situation for the world, we can be ready. So young people, take the lesson out of this, that using our brain to be ready for the challenge ahead, using the lesson of the past and the lesson of today out of the last science, implementing evidence-based intervention according context with the right strategy will be what will bring to all of us a better life.
Wonderful. That was Professor Binagwaho of the University of Global Health Equity.